Hello, everyone. Just a brief update from Chief Hanson and I on the ongoing COVID-19 responses in the town of Lancaster. We just want to keep the public informed as best we can with all the ongoings in town and all the information that is coming from a number of different angles. I just want to let everybody know that town services are still being provided. We do have limited staff on a rotating basis in the building, so there is a limited individuals, but the phone lines can be answered from any location. So the fire department is still available by phone, 978-368-4003. For permitting issues. Inspections will be limited for the foreseeable future, but you do have access to them. Police department is still going to be staffed 24/7. Any legal deadlines in terms of licenses to carries, feel free to reach out to them. The vestibule in the lobby is open. The town clerk's office is still available. We encourage you to get a hold of them via email for any needs you have there. Obviously, access to the building is limited, but most of their transactions can be done electronically. Same with the treasurer collector's office. The library is doing basically a drive-by service. So if you contact the library directly, they'll be able to put whatever materials you need on the outside. Returning items, there's a drop box outside the building, so you should have easy access to whatever library materials you may need. The senior center is closed, but Meals on Wheels are running. Limited van service is available, but the Friends of the Library also has an ongoing ability to deliver any necessary items or pick up food for those seniors who may have limited mobility. The building department is doing inspections in empty homes and by appointment where arrangements can be made to make sure public health and safety is addressed on both ends. And the Board of Health agent is still available by phone, and the office is staffed, so feel free to call the town's main number, 978-365-3326, and you should be able to access any town staff directly. But again, the building is closed. We are going to have cleaning crews in here on a regular basis, just making sure that the building is safe for the public to return, hopefully the first week in April, but we will keep people posted. The other thing is just please be aware of any reverse 411 calls that may go out. We are assessing the need to change our town meeting and or election dates and times. So again, feel free to call the office if you have any questions, but definitely pay attention to any communications that the town sends out. We're trying to be selective to not inundate people with unnecessary information, but want to make sure we keep people informed as much as humanly possible. Mike, do you want to add anything to that?
Yes, as far as ambulance responses, 911 calls for people that suspect they may have the COVID-19 or symptoms, we are asking that you call your doctor first, and if they recommend you call 911, then call 911 and give the dispatcher as much information as you can. They are trained to ask you certain questions as related to the COVID-19, and it'll allow us to respond appropriately with the right precautions that we'll need. During this time, if you do have suspicion of it, you'll only see one emergency medical technician enter the home. That is to limit the exposure to our crew till we can confirm if there is an exposure or possible exposure or not without exposing our whole crew. But any other issues, do call 911 first. But if you just have any of the symptoms that they are putting out through the CDC for this, we ask that you call your doctor first to try to help the spread, to prevent the spread of this. And just to say with the social distancing, with the conference call today, they are saying keep the 6-foot rule. I do believe they said no more than 15 minutes is something they're saying. And I think the numbers we can give, what they gave us today was yesterday there was 218 confirmed cases. As of today, there's 256 confirmed cases in the state. The test centers are starting to open up more. They're getting test results back quicker. They are contracting with private labs now. So it does still, it is a contagious viral, and we just ask everyone to take all the necessary precautions. The town's playground was closed. It was padlocked for the same reasons, was to keep people away from there because it cannot be disinfected as we would normally like it to be.
If people are looking for a good source of information, we do want to make you aware, please use the Massachusetts 211 line. It is probably your best source of information related to the COVID-19 response and what you can do. If you have access, please look at the Massachusetts Department of Public Health website. They are issuing the best, most up-to-date guidance on the response and how best to protect yourself. If you or you know of a small business who is suffering economic damage as a result of this, please have them call the Office of the Board of Selectmen. We have been in contact with Senator Markey, Senator Warren, and Congresswoman Trahan's office. There are both federal and state resources that will be made available in the near future to try to assist them. Beyond that, we just ask that you take care of yourself first. And if you know of anyone who's elderly or disabled who may be isolated or could have a problem during this time, we ask that you check on them, and if there's a need for us to follow up with a wellness check, we will do so at your request. We appreciate everybody's understanding during this very difficult time. It's been trying for both myself and all the staff here, and we're trying to do the best we can to deliver services under what are some constrained guidelines right now. So we appreciate everybody's help. Feel free to keep in contact. Thank you very much. Stay safe.